Namaste. This is Yoga Therapy Podcast, and I'm your host, Shira Cohen, yoga teacher, yoga therapist, and Ayurvedic wellness educator. In these conversations with experts in the field of yoga therapy, you'll find out what it is and how it can help you and your loved ones to reclaim well-being. We'll touch on physical as well as mental health, physiology, emotions, women's health, spiritual well-being, goddesses, and self-development in the fullest sense. Listening to another story can change ours, so thank you for showing up, and let's begin this journey together. Hello everyone. So today we're joined by Steffany Moonaz. Steffany is a yoga therapist and researcher, currently serving as Director of Clinical and Academic Research at the Maryland University of Integrative Health, which offers the nation's only master's degree in yoga therapy. Dr. Moonaz spent 8 years at Johns Hopkins University developing and evaluating a yoga program for individuals with rheumatoid arthritis and osteoarthritis, which has been replicated in collaboration with the National Institute of Health. She is the founder of Yoga for Arthritis, an organization bringing evidence-based yoga programs to people with arthritis nationwide, as well as educating yoga professionals to work safely and effectively with this population. Dr. Moonaz collaborates on multiple interdisciplinary research teams and mentors emerging integrative health researchers. She serves on the boards of the Academic Collaborative for Integrative Health, Accessible Yoga, and the Scientific Advisory Committee of the American Academy for Naturopathic Physicians. Wow, what a mouthful that was. Okay, let's begin. Hello, everyone. So today we're joined by Steffany Moonaz. Hey, Steffany. So nice to have
Shira.
you here. Yes.
So nice to be here.
Yeah, it's been good just getting to know each other for the last 5 minutes. So I wanted to ask you about quickly just your journey of yoga and how it became yoga therapy and how yoga therapy is different to just normal yoga.
Okay. Yeah, sure.
Yeah.
So, I started dancing when I was 3. My mother was a dance teacher, and I got very serious about dance as I got older. And so I would be at the dance studio most days after school. And there was a day that I was feeling particularly crummy. And about halfway into the first dance class of the evening, I noticed that whatever I was upset about, which was probably some, unimportant middle school drama, had just melted away. And in that moment, I had an epiphany that whatever was happening for me in that dance class alleviated my suffering. Even though it was a minor cause of suffering, I thought whatever that mechanism was could be applied to other forms of suffering. And it occurred to me also, lots of people are experiencing a lot of suffering and probably don't know that they could do this and that they would feel better. So I told you that I got lucky with my Dharma earlier, and I think that is what I was called to do from an early age, was to apply the concepts of mind-body integration, mindful movement, meditation and motion, however you want to think about it, that is present in both dance and in yoga to help alleviate suffering. I started practicing yoga as part of my dance training and then became a yoga teacher, like many people do, just for my own experience. And of course, it ended up being my career. But through a serendipitous course of events that I won't get into here, I ended up working at the Johns Hopkins Arthritis Center right after my 200-hour yoga teacher training. And so I started working with people who had arthritis immediately without having the training or the tools to know how to do that. So it was really an exploration together between me and the patients. Let's figure out how this works between what I know, about yoga and about anatomy. I was also pre-med and a scientist by training at that point. And what they knew about their own experience and their own bodies and what felt good and not good and what they'd been told, we worked it out together. And it wasn't until working with that population for a little while that I did become a yoga therapist by training. And then acquired a PhD in public health. And the focus of my research then and now has always been applying the tools of yoga to help people with arthritis in all of its forms to live differently, to thrive, despite and with and because of and all of it.
And how come it became arthritis?
Yeah, that's a good question, Shira. I was conducting a yoga teacher training a week or so ago, and someone asked me that. And I mean, the flippant answer is, why not arthritis? Arthritis is the leading cause of disability. And so if we're talking about, and I'm a public health researcher, right? So I think on big scales, and I think about population level problems and population level solutions. So if I want to impact suffering on a broad scale, right, arthritis is a reasonable place to do that. But I didn't actually seek out arthritis as a focus. It happened to me. Yeah, I mean, it was actually, I was working in a lab with a gastroenterologist who said, you should write a paper about how movement helps people with rheumatoid arthritis. Out of the blue, she said that. And that was really the beginning of my investigation of how this work would apply to that population. And now that's exclusively the focus of my work.
Wow. Yeah. Yeah. I've seen. So Steffany has done a lot of research. I just looked at your PubMed articles. There's 17 up there. And yeah.
That's only with my married name, Shira.
Oh. Okay. What's your unmarried name?
So my husband is a Mooney and I am a Haas, and we smushed them together to make Moonaz.
Really? How cool.
It's a made up last name.
Yeah. Yeah, great. Okay, I didn't recognize it. Okay, and I just wanted to go back a little, because you said when you danced, when you were young, any issues that you had, you felt they were released. Do you feel, because I feel this, I love dancing. If there's a mood or something, I put on music and I dance and I release it.
Yeah.
Do you think it's an emotional, passionate kind of expression that we're changing physiology?
There are so many mechanisms by which this happens, Shira. It's it's a lot to unpack.
Okay.
I think that for me back then, because in that moment, what I was experiencing was psychological suffering, right? And the population that I work with is experiencing suffering on many levels, which is why my work is really based in the Panchamaya Kosha model, because I think that you can't isolate, one level affects all of the others. But I believe that what happened for me is that I was so fully absorbed in the experience of my body that anything that I was doing with my mind, the ruminations of my mind of revisiting whatever insult or, who even knows what the drama was, but I suspect that it was interpersonal drama or academic drama or whatever it was, melted away because I was fully absorbed. There was no past or future. There was only the moment. And in that moment, I was dancing, right? And that's all there was. And so I think it's not only mindfulness of being fully present in the moment without rumination or distraction or projection, but it's something about being absorbed in the experience of the moving body that adds a layer to that doesn't necessarily happen in seated meditation, for example. I do think there is something to that mind-body integration that has a particular power.
I would add, it's because you're moving the body and you're
Yeah.
coming from a feeling within, you're using the senses, and that is presence directly. Whereas if you're seated, you can go off into the mind, past, future.
I also think that for some people, especially the people that I work with who are experiencing pain in their physical body, excuse me, that there can be a disconnect between the mind and the body, and even an adversarial relationship between the two. The body only causes me problems. It causes me pain. I don't want anything to do with it. I'm going to ignore it, suppress it, hate it, whatever that is. And then I think also in our sedentary society in general, there's a value of the mind over the body that considers the body to be a vehicle for the mind to execute functions, right? Like the body gets the mind around and allows it to do stuff, as opposed to valuing the experience of the body
for itself,
for its own sake.
Yeah.
Right, exactly. And to actually be present in the pleasurable experience of the moving body, especially if you have held judgment over that body or been frustrated by its limitations. There is still access to joyful experience in the moving body that I believe this work can help people discover. In addition to the importance of all of the other practices that are not movement that yoga has to offer.
Yeah. And the wonderful thing about yoga is that you can mix them all together.
Exactly. And you can mix and match. So you can use these tools in isolation when they're useful, and then you can also pull them together as an integrated whole.
Yeah. So I just wanted to ask, because what for you makes yoga therapy different to yoga?
Oh yeah, I conveniently skipped over that part of the question.
That's also a difficult one.
Yeah, I mean, there is a lot of work being done as yoga therapy creates itself or recreates itself, because it's not a new field, but it's an ever evolving one. There is a desire to make the boundaries between yoga teaching and yoga therapy very hard and fast. And I don't think that that's true. Unfortunately, I think that there is gray between yoga teaching and yoga therapy, which gets complex for people in either profession who are dancing in the in-between. And what I mean by that is that there are yoga teachers who work with clinical populations and teach yoga as an educator. When they do that, they are necessarily adapting, adjusting, making decisions about what is appropriate, what might serve, tailoring a class plan, so to speak, to instruct someone how to practice yoga safely and appropriately. Whereas a yoga therapist is working with an individual or small group to co-create a therapeutic plan. So the relationship is different in that in yoga teaching, the relationship is between educator and student. I know these tools, I am going to teach them to you, and then you will have them. A yoga therapist is a clinician. And so they are working with the client to move on a journey toward wholeness and healing. And some of the features that distinguish them are that yoga therapists necessarily do a comprehensive intake, they develop a plan of care, they conduct assessment to determine movement in the direction of the goals of the client. But I think in reality, both camps are doing that, right? Yoga teachers who work with therapeutic populations are also doing some level of intake. They're also, even if it's qualitative and observational, they're doing some level of assessment too. And I think that it becomes challenging, even though, even the fact that yoga therapists have necessarily so much more training as a minimum, right? Yoga therapists have a minimum of 1,000 hours. Most of them have more. There are also yoga teachers who have an incredible amount of training because they have taken it upon themselves to go from 200 to 500 to half a dozen different specialty trainings to, right, whatever else they add on to that and all of their experience. So I think it can be harder to tease them apart than we would maybe like it to be. Mm-hmm. And it's about the intent and the relationship, because a yoga therapist also, even though there is a therapeutic plan developed and there is hopefully movement in the direction of that plan, as yogis, we have to practice non-attachment with regard to those goals. So even though we may be moving in the direction of something, we're not holding on to that as a necessary outcome. So although it's goal oriented, it's not goal focused or not goal driven, if that makes sense as a semantic difference.
Yep.
So I work with both population. I work with both sets of professionals, yoga teachers in, sort of working with clinical populations, and yoga therapists who are focused on doing this work. And there are plenty of similarities between them.
I'm glad you brought that up because, I think there was a point where I was really trying to find that divide. Yeah. And it's true. A lot of teachers just keep studying more and more and more. And even I worked for a while in a clinic in Berlin, mm-hmm. and we were doing the same that you were doing at the Johns Hopkins University. It was just experimentation. We did something and asked how it was, and then you see the next week and you see changes, positive or negative, and it's trial and error. So it's nice that you brought that up. Thank you. So let's see. Please tell me and listeners about autoimmune conditions during the pandemic.
Oh boy, Shira, it's so complicated. Well, okay, so there is this umbrella of arthritis that includes over 100 different conditions. And the most common of them is osteoarthritis, which is what most people are familiar with. It's the kind of arthritis that becomes more prevalent as we get older. It's associated with a wear and tear on the joint tissue. It can be more likely if there's been a prior injury or if there's overuse of a particular part of the body. That type of arthritis is not an autoimmune disease. It does have an inflammatory component. And we used to think that it was really just localized. If you have osteoarthritis of your knee, the only part of the body that's affected is your knee. It turns out that there is actually some systemic inflammation associated with even osteoarthritis, far less than all of these other arthritic conditions that are in the same umbrella, mm-hmm. that are systemic autoimmune conditions. And so there are a whole bunch of them. And some examples are rheumatoid arthritis, lupus, Sjogren's, scleroderma, and closing spondylitis, a lot of pretty rare conditions that some of your listeners may have heard of, some may not. And they can affect various tissues of the body. The way that these conditions function is that instead of it being a mechanical wearing down of the connective tissue in the joint, the immune system recognizes some aspect of the joint tissue as foreign. and says, we better take care of this. We're going to send the immune system cells to that location and start getting rid of this stuff. Unfortunately, what they're getting rid of is tissue, right? That, that is an important part of the body's structure. So arthritis, rheumatoid arthritis, and osteoarthritis both have a loss of cartilage, which caps the end of the bones in synovial joints. But osteoarthritis, it's because there's sort of a rubbing of the cartilage at the joint, whereas with rheumatoid arthritis, it's actually the capsule around the joint that starts to get inflamed, and the immune system starts to attack there at the capsule, and it ends up also wearing away the cartilage. So some of the features of it are the same, but the way that it happens is very different. So how do you manage osteoarthritis from a medical perspective? By symptom management. So it's, what can I take for the pain? Maybe it's a cortisone injection. Maybe it's eventually joint replacement, but there isn't anything that can manage the disease process itself other than lifestyle. Mm-hmm. So, strengthening the muscles surrounding the joint, making sure that the tissues are hydrated, enough movement, but not too much, all of that. On the autoimmune side, however, there is something that can be done to address the underlying mechanism, which is calm down the immune system. Mm-hmm. So the way that happens medically is through immune suppressing medications that stop the immune system from attacking the joints. Now, we didn't used to have those. And, I know that people in the yoga community have varying degrees of comfort and acceptance of medicine as a profession, as an approach. I would suggest that medicine is a giant tent that has a lot in it, and some of it is incredibly important. And while there may be arguments for and against suppressing the immune system, I will say that before these medicines existed, people with rheumatoid arthritis had a much shorter lifespan. They also usually ended up with severe deformity. So there are pictures that you might sometimes see in textbooks of hands with rheumatoid arthritis that are gnarled, right, and not usable, right? That doesn't really happen anymore because of these medications that are available. The downside is, well, there are a few downsides. They're not without side effects. And also, they are not specific. You can't tell the immune system to stop doing one thing, but to still do something else, right? It's like a dimmer on a light switch. And so either you turn it down or you don't. You can't change the color of the lights. I don't know if that's a good analogy, but so if you suppress the immune system so that it stops deteriorating the joint tissue,
it just stops.
You are also suppressing the immune system from doing other things, right? So one reality of life with these conditions, if you're taking these immune suppressing medications, is that you're at greater risk of infection because the immune system is less able to mount a response to an infection. It means that if someone who's on one of these medications needs to have like a minor dental surgery, for example, they're at higher risk of an infection, and they may even need to go off of those medications for a short period in order to have that procedure, let alone something more serious or a greater risk. So let's get to the pandemic. Obviously, people on immune suppressing medications are at greater risk for a COVID infection, right? They're at, or the infection is SARS-CoV-2, but you know what I mean. They are also less capable of mounting an effective response to it. So, there's still a whole lot we don't understand about this virus, including why some people are completely asymptomatic, even some people who are high risk. And then there are some people who seem to be perfectly healthy and have a very serious illness from it. So there's a lot that's still not understood, but we do know that if your immune system is suppressed, yeah. Right. Okay, so now let's add to that social isolation is stressful, and stress exacerbates all of these conditions. So what happens with stress, and this is a very well understood situation, right? Constellation, it very much is a constellation, that actually any stress, psychological stress, physiological stress, anything that puts stress on the system being, the human being as a whole.
Psychosocial, yeah.
All of it, right? Yeah. All of that can increase the risk and the severity of disease flares. A disease flare is when there's an uptick in the symptoms of the condition. Mm-hmm. And some of these conditions have more frequent flares than others. And there are some people who experience years with very stable disease where they don't have any flares. And there are some people who have a very hard time getting out of flares. So it varies by condition, but it also varies by individual. But regardless, stress of any form increases the likelihood and the severity and the duration of a flare. And in fact, stressors can be associated with getting the disease in the first place, or getting the diagnosis, or turning on the switch, that yeah. Right, exactly. So that's part of the epigenetics of these conditions, is that there is probably a genetic component to many of them, but it can be any sort of serious life event that puts physiological stress on the body. So it could be a major infection, a disease, the flu, something like that, that's a physiological stressor. It could also be a big move, a divorce, a loss, any sort of serious life event that's associated with psychological stress, and even positive stress. Like I told you that I'm planning my daughter's bat mitzvah, which is incredibly stressful. It's a good stressor, but it's still, I feel the effects of it physiologically and psychologically. And all of that can exacerbate, right, can trigger the flares. And there are, that's not always the case. There are some people that just wake up one morning and their knee is the size of a grapefruit and they have no idea where it came from. So it's not universally true, but there is a correlation. Mm-hmm. And so you add the situation where people are at higher risk. Because they're at higher risk, they may be more fearful. Mm-hmm. Because they're at higher risk, they may be more careful. As well, they should be, but that also means that they're more likely to be isolated. It also means that they're more likely to be stressed, and all of the things that we do to manage our stress in a healthy way may be less available, including our regular routines of healthy eating and exercise, and all of the stuff that we do to take care of ourselves, our routines and rituals and all of that. We all know that it's been challenging to maintain those. And in many ways, they've really had to be recreated and re-envisioned in a different way. And that's especially important for this population.
Yeah. Yeah. Wow. It's very complex. There's so many layers to it. Yeah. Wow. I have to take it all in. Yeah, no, I have someone in my family who has an autoimmune, and I've seen how just psychological stress is so effective in causing a flare.
Yeah, I'm going to add another layer to that, Shira, which is that because people who've had these conditions for a while and who understand them pretty well, and also, people who, probably the kinds of people who listen to your podcast, who are pretty self-aware and informed and using tools and, empowered with the self-efficacy to manage whatever their challenges are. Those folks in particular, because they know about this, they know that stress exacerbates disease symptoms. there can often be shame and blame associated with a flare, because people think, well, I should know better. I should have been doing this, or I should be on top of this by now, or I should have canceled that thing, or I should have been eating my greens, or whatever the shoulda, coulda, woulda, that, even that, and eaten not just on the self, but also on others. Like, it's your fault because you did this and that stressed me out, and now I'm in this flare, right? And while that is sort of a natural tendency, it's really unhelpful, because we are where we are, and we're all human, and we're doing the best we can with the tools that we have and our ability to cope and function. My own therapist talks about the good enough mother. Like, you don't have to be perfect. Like, sometimes good enough is good enough.
Oh yeah, good enough is great.
right. Especially now.
Yeah.
But I think that, if you're used to being very good at anything, if you're used to being really good at managing your disease and really good at staying active and staying on top of it and taking care of yourself, and now it's harder to do that. And now, despite all of your tools, it's still not enough.
Yeah. I've noticed this.
Yeah.
And that's why I think, for me, it's been a real journey trying to find out how to work with emotions, because like you said, we're coping, and then we've got another layer, and then these emotions just erupt. And I think a lot of us are not emotionally literate. It's not even about emotional intelligence, but just knowing you have that emotion. What do you do with it? And we can channel it. And like you were talking about, there was guilt, there was shame, there is fear, all these layers. Yeah.
And I think also, I often hear people talk about last March when we thought this was going to be a 2-week
3 weeks
break, right? And so I also think that there's a stamina component to it, in that the longer it goes on, the more allostatic load we're bearing, the harder it is to sustain this constant.
I felt that this week. I mentioned it in my last podcast. I just feel the motivation is running out, to keep yourself self-disciplined and to keep doing all those things. Yesterday, I had my first class. I have a class every 2 weeks, and it just feels so good. And you just feel so excited that you're needed by people. It's like, oh, I need that.
So I don't know, Shira, if I'm sure some of your listeners have run marathon. I've run marathons. And it's that last stretch. It's both the most challenging and also the most invigorating. It's like, and I feel like that's where we are. I mean, who knows what's going to happen with the variants? And, I know also that all over the world, vaccine distribution is very different. But I think that this may be the hardest part of it.
Yeah. There's also a moment, I think, where we've kind of surrendered. I know I was fighting it a lot. In the beginning, I was totally happy. Oh, great, I can write my book now. And then you sort of get like, oh, I got a bit paranoid. I thought there's something going on. Some people are making lots of money out of this, and lots of people are not. And then I kind of said, okay, just let it go. It is what it is, and see what it is. But now, it's been a hard few
and then
weeks.
add chronic unrelenting pain, add the kind of fatigue that makes it challenging to even get vertical, add stiffness that makes it difficult to move, add in some cases feverishness and chills and body aches and fogginess and disorientation and all of that. Mood changes, depressive symptoms are really common for people living with these conditions. So what all of us are experiencing who don't have.
And anxiety too, I read.
So there are several reasons why these mood disorders are more common in people who have arthritis. One is that it's really hard to live with these conditions. It's really hard to have physical function challenges and not be able to do the things that you once were able to do or that you would like to do. For people who have something called morning stiffness, it can take hours in the morning just to get yourself going.
Wow.
And that can be enough to wear somebody down psychologically, but also physiologically. These are inflammatory conditions. So depression is an inflammatory disease. And when you have systemic inflammation, you're at greater risk for all systemic inflammatory conditions, depression being one of them.
And how can you explain that to me and the listeners? How depression is a systemic inflammation? Did you say?
So there is an inflammatory component to depression. Yeah.
Okay, yeah, I thought so. Okay. Is it because it's a suppression of emotions and physiology?
So I am not a psychologist or psychiatrist, so that would be outside of my expertise, but I do know that it's an inflammatory condition, and that when you have an inflammatory condition, you're at greater risk of depression for that reason. So it's outside of just the psychological experience of the health challenge itself.
Okay. And what does it inflame? Depression.
So systemic inflammation is not an inflammation of a particular tissue in the body. So we have inflammatory markers that are part of the immune system that get released and travel throughout the bloodstream. So it's different from localized inflammation, which is a feature of osteoarthritis, like my knee is swollen, my hands are swollen, right? Where you can visibly see that the tissues of the musculoskeletal system are swollen themselves, right? It's a systemic whole body experience. Now, there may also be localized swelling. So for somebody who has rheumatoid arthritis, they may have a joint that is visibly swollen. That swelling is localized, but it's their entire system that is experiencing that systemic inflammation. So one of the ways that we measure systemic inflammation is through blood tests. So we take a blood sample and we look for particular markers in the blood that tell us whether systemic inflammation is, how severe that inflammation is. And that's what I was saying, that with osteoarthritis, you do have a tiny little bit, but for these systemic autoimmune conditions, it's much greater.
And which markers, can I ask?
So C-reactive protein is one of them. SED rate is another. There are a bunch of interleukins that get looked at. So it's a variety of different markers that we might measure.
Okay, thank you. All right. So I was reading your articles and I saw there was significant. Yeah, yes, there were so many, but I couldn't see the full versions of some of them.
Right. That's a whole other conversation.
Yeah, it is. And so for the arthritis, the yoga therapy for arthritis, there was significant improvement in physical and psychological markers, even 9 months later. And the quality of life.
You're talking about the study that we did at Hopkins, the randomized controlled trial. Yeah. So actually, I will tell you, so we did an 8-week series, and it was 2 classes per week plus home practice once per week. So ostensibly they were practicing yoga 3 times per week, although the home practice was variable and attendance to an extent. But then, so we measured all of this stuff, when they first started and after the 8 weeks. We also had a comparison group that was not getting yoga so that we could look at the differences. And then we looked at them 9 months after the yoga program had ended. That not only had the improvements sustained, but there were some things that had not quite reached significance at 8 weeks that were even better at 9 months.
Wow.
And I will tell you anecdotally, even though we stopped collecting data, right? That like after 9 months was the end of the study, but we still know these people, and many of them are still practicing yoga. This is like 10 years later for some of them, Shira.
Yeah, I saw that.
And they're still practicing yoga, and
that's so exciting.
And they continue, and, you know, and what's interesting is that it looks really different for all of them. So some people use the breath and they meditate, and some of them do a little bit of hatha practice on their mat, and some people go to yoga classes, and so, you know, they're all sort of into, some of them just use, you know, restorative poses when they're having a flare, or they do the deep relaxation at bedtime. They all sort of took different skills and tools from it, so they're all using it in their own way, but they continue to report these benefits.
Yeah. Wow. Great.
And so it's think about how cost effective it is, you know, in terms of disease management, to give somebody 8 weeks of yoga and then they have this for life.
Yeah.
Right? It's something that they can use forever. And this is why I'm really interested in eventually doing some of this work. I mean, I do this work with kids who have arthritis, but we haven't done any research studies looking, and I would love to see what happens when you teach kids these skills early on in their diagnosis, and then they're living with this disease with these tools from the get-go. Yeah, because there were some people in the study who, by the time they got to us, they had arthritis already for decades. And you know, and one of them said, well, I didn't know I could do this. Nobody ever told me that this was an option.
Well, that's why I'm doing this podcast, because I want people to know there is options.
Yeah, and I think it's becoming a lot more common now for people who have these conditions to recognize that there is a kind of yoga that is available and appropriate for them. I mean, unfortunately, many people don't know the difference from one yoga to another, and so they just think, oh, I heard that yoga is good for people with arthritis, so I'm going to go to whatever place and take whatever. And so then it's really unfortunate, because I think that that's part of where the statistics about yoga injuries are coming from, is people just not consuming the yoga offerings that are appropriate for them. And unfortunately, also, while we said there are a lot of yoga teachers who go above and beyond their training, that is certainly not the rule. And there are plenty of 200-hour yoga teachers who just don't know how to work with people who have movement limitations and chronic conditions who come into their classes. And so, you know, I also think another opportunity from this podcast and others is to educate the public about the difference, that it's not a one size fits all.
Yeah. And I would just like to add that there's also a lot of yoga schools that have opened up in the last 5 years, for example, in India. And I know, because I used to go to India a lot, that some of those teachers are not even yoga teachers. They never practiced yoga, and then they teach yoga teacher trainings. And so, there's a lot of that too. So could you explain to the public, to the audience, what is a good thing to look out for, apart from extra studies, or maybe that yin or restorative, or what is a good thing?
So, you know, I get asked these questions all the time, Shira. So we can go sort of one by one. So restorative poses are great when somebody is experiencing a flare. Restorative poses are intended to support the body. They're intended to help the individual release, relax, let go. And I think lots of people who are living with these conditions, as a metaphor, do not yield. They don't allow themselves to be supported. And so one of the ways that I talk about restorative poses is, can you let the support hold you up, you know? And what does that mean in your life in terms of the support of friends and family, of, you know, a connection to the divine, of whatever support is available to you, can you yield? So I think restorative poses are really useful, especially in times of flare and in times of overwhelm. It cannot be your whole practice, because they do nothing to improve physical fitness, which is important for people living with arthritis. So that is also true of yin yoga. So yin yoga, the idea is to stretch, to like go deep into poses and stay there for a long time. One caution that I have about that for people with arthritis is you don't want to stretch connective tissue when your connective tissue is getting deteriorated, and you want stability and strength to support that joint, right? So it's great to stretch your muscles and to improve your range of motion. But the premise that we want to get into the deep connective tissue of the body and stretch that is of concern for people who don't have stability in their joints. Additionally, if that is your whole practice, then you are not building strength, which is really important, because not only do you need the stability, but especially for these autoimmune conditions, muscle cachexia is part of the disease, which means that there's a loss of muscle tissue. Aside from whatever reduction in exercise you're doing, your immune system is also deteriorating your muscles. So it's really important to have standing poses, right? Warriors and poses that build strength and stability. I also tend to recommend that unless somebody is experienced with yoga and has had their arthritis for a while, understands it really well, a flow practice that moves quickly from one thing to another doesn't really give you the time to be able to set yourself up and make sure that your alignment is healthy and appropriate. And so for people with arthritis, also, there may be more of a reliance on props in order to adjust and support the pose, which is challenging to do in a vinyasa flow. I mean, it can be done, and there are people who are experienced and able to negotiate the props and the modifications and move in a flow, but I don't recommend that as a place to start, for sure. So a gentle, beginner, basic, therapeutic, you know, maybe chair yoga, maybe yoga for seniors, and I would look for instructors who have experience and training in working with clinical populations, working with anyone who bills themselves as an accessible yoga teacher, who understands that we all have different bodies, we all have different challenges, and our yoga practice is going to reflect that, is really important. And I think also teachers who have a basic understanding of these conditions are more likely to empower their students to find their own practice in a way that is right, that there are yoga teachers who believe that there is one right way to do things, and that will not work. I mean, that won't work for most people, frankly, but also especially people with arthritis who have oftentimes physical limitations and or disability already probably feel a little uncomfortable going into a yoga space. And it's important that they be welcomed and included and accepted for who they are and how they show up, because that one time that they try yoga may be the only time if they have a negative experience. And I've definitely heard those stories of,
that's a shame.
you know, or God forbid, being sort of like pushed into a position. That's a whole other conversation too, is that don't ever move anybody's body for them, you know, especially somebody who has chronic pain.
Definitely. Okay, that's good. That's great. That's clear. Would you like to finish off with a practice for?
I would love to. Yeah, sure. Okay. So I know we're just audio here, so I'm going to do my best with my verbal description to sort of walk you through a little bit of joint mobilization. So this is really good when you first get up in the morning and you might be feeling a little bit stiff, or for people who sit for long periods of time, or if you've been on a car ride. So it really is great for anybody, but especially people who have arthritis, because it's the synovial joints of the body that develop arthritis. And when we introduce a little bit of movement, it sloshes the synovial fluid around and sort of lubricates the joints and can help us feel a little bit less stiff. So we're going to start at the feet. And if you sit in a chair with your feet planted on the floor, I want you to just wiggle your toes as though you were playing the piano with your feet. And you may notice that you don't have as much control over your toes as you do your hands. And that's all. It's not about what our feet can do necessarily. It's about how they're mapped to the brain. So the more you practice wiggling your toes and sort of articulating them one by one, the better you get at it. And the more articulate your feet are, the better you can balance. The more stable you are, the less likely you are to fall. So that's a good practice for all of us. You can lift the toes, spread them wide, and sort of feel that stretch, and then lower them down, and then lift up your heels so that the balls of your feet are on the floor, but the heels aren't. And then drop the heels down, lift up the fronts of your feet, and then rock back and forth. So you're going to lift up the heels and then the toes. And then you can alternate. This is a little bit of a brain game. On one foot, lift up the heel, and on the other foot, lift up the toes, and then switch. And so it's going to be sort of like a little marching that's happening with your feet. Okay, and then let your feet settle down. You may need to slide back into your chair so that you're nice and stable on the chair and you're not going to slide out. Stretch your legs out in front of you. You may want to hold on to the sides of your chair to do this. So now you're engaging your quadricep muscles, the muscles of your thighs, and you're going to roll your ankles out and roll them in. And they might click, and that's fine. You can roll both of them to the right and roll both of them to the left. You can alternate flex and point. And then lower the feet back down. And now extend the right leg out and lower it. And extend the left leg out and lower it. And you can coordinate your breath and movement here. So you exhale as you lift the leg, inhale as you lower. Exhale as you lift, inhale as you lower. And you can do that in your own time and sort of notice the tracking, the alignment of your hip, knee, and ankle. And this is a nice opportunity when we're not weight bearing and when we can see our legs to sort of see what our movement patterns are there. And then from there, sit forward a little bit in your chair so you have some room behind you. And imagine that your spine is like a big wooden spoon and you're going to stir a pot of stew. So you're going to take your whole spine around in a circle. And as you do this, this is actually not about the spine. It's about the hips, because as we do this, we're getting some movement into the hip joints, and you'll feel that your weight is sort of shifting from one side of the pelvis to the other. And then if you went clockwise, go counterclockwise. And then for another little brain game here, you can try doing a figure 8. Maybe do a figure 8 one way, and you can do your figure 8 in reverse. Make sure that you're still breathing. Sometimes when we're really focused, we lose that deep diaphragmatic breath that helps to keep the stress response at bay. And then settle back on center. Give a little roll of the shoulders backward. And then forward. And then you can alternate, roll one shoulder and then the other. And you can feel that as you do that, the rib cage sort of moves along with it. And forward. And then let that settle down. And if you have a yoga practice that you're probably familiar with, cat-cow, where we arch and round the spine. So we're going to do that seated. So you're going to bring your belly button back toward the back of the chair and round the back. So you're rolling onto the back of the sits bones, letting the head lower. And then come back to center, arch the back so the sternum lifts and the shoulder blades draw back. And then move back and forth between those, again, coordinating with the breath. Exhale as you round, and then inhale as you arch. Or exhale into cat and inhale into cow. Bring yourself back to center. Take your arms out in front of you and give a little wiggle of the fingers like we did with the toes. And some of you actually know how to play the piano and can do all sorts of little air piano movements that I don't know how to do, but wiggle your fingers however you'd like. Roll the wrists out and then roll them in. Spread the fingers out as wide as you can, stretching out the palms, and then either make a fist or bring the fingertips toward each other. So it's not necessary to make a fist, but you can if you'd like. And then spread the palms wide and tighten the fists. And do that again. Make sure that you're still breathing as you do that. And then from here, we're going to articulate the fingers, bring the thumb to the first finger and then open to the second finger, open. And it's okay if they don't touch. Third finger open, fourth finger open. You're just bringing the thumb toward each finger. And you could even do a little mantra with that. When I work with kids, we do peace begins with me, but you could use any 4-syllable or 4-word mantra with that. Just articulating the fingers, and then shake the hands out. Do a little freestyle swim with your arms. And then if you have the coordination available, try doing a little backstroke. And then shake the arms out, let them hang, lower the head down, just gaze down. And then lift the head just a little bit, just to open the throat. We don't want to drop the head back, but we're just gazing up slightly, and say yes. And think about what you're saying yes to. Yes to opportunity, yes to peace, yes to joy, yes to connection. And then bring the head back to neutral. And then turn the head from side to side and say no. No to overwhelm. No to frustration. No to isolation. Whatever it is for you today. And then come back to center. And now tilt, take your ear toward one shoulder. And then up and over to the other. And you may feel a big stretch in the sides of the neck into the shoulder as you do that. And then settle back on center again. Take a moment just to move the whole body or anything that wants to be moved. Wiggle, shimmy, shake. And then settle in. And you have mobilized all of the major synovial joints of the body.
Wow, that is so underrated, isn't it? I had a time where I had a sore knee and I just couldn't do most yoga poses, and I had to do these joint freeing series.
Mm-hmm.
And once you get into it, once you yield, it's like, oh, this is so good. It's so meditative.
You can also, I mean, you can feel the energy, you know, the prana.
Yeah,
right?
yeah. That's what I mean.
Yeah.
And especially when you use the breath and you go
right.
slow enough. Yeah.
And it's so short. I mean, that was a few minutes, right? And it totally
I think 5 minutes, and I
right.
felt everything. Yeah. So strengthening is really important.
I mean, I think that it's really a balance, Shira, between stability and mobility, right? Mm-hmm. So what we just did right now was all about mobility, all about mm-hmm. getting things moving. Mm-hmm. But if you focus too much on mobility, and I think this is unfortunately common in yoga, is there's so much emphasis on how far you can stretch and what position you can get into. And yogis are rewarded for being able to go very deep into things. And also people who naturally are very mobile are drawn to yoga. And it's those folks who are very mobile, who need stability the most, who need the strengthening and the holds and the challenging postures. And so I think that with arthritis, that's true, but for all of us, it's true. And where you tend to want to go may not always be what's best for you.
Well, that's what I've noticed in anything in life. Whatever we're good at, we just overdevelop.
So I think thinking about both sides of the coin, that we want both stability and mobility and not one at the expense of the other.
Okay, that's a great tip. Thank you. Anything you would like to leave the listeners with? So you've written a book.
Book. It's true. I have. Yeah. My book is called Yoga Therapy for Arthritis. And I am really proud of this book. And I'm grateful to Singing Dragon, my publisher, because they really let me write this the way that I felt it needed to be written. It definitely does have asana, poses and adaptations, versions of those poses, but that is one piece. It has a lot of science, but it also has a lot of yoga philosophy, and it has real stories of real people living with arthritis whose lives were transformed by yoga, and it progresses along the koshas. So it starts with the physical body and it moves all the way to meaning and purpose in life, and how each of those is both impacted by arthritis, but also is impacted by yoga practice, and the way that the various tools of yoga can be harnessed in order to facilitate change in the whole person living with these conditions. So it's not about what's happening in my knee and how does yoga practice change the knee, right? That is true, but it's so much more than that. And I was able to include all of that in the book. So I hope that people enjoy it.
Yeah, I'm sure they will. Now you make me want to get it.
So if you're a yoga professional or a person living with arthritis or a healthcare provider, it's really written for all of those audiences. And also I do workshops and yoga teacher trainings and have classes online and all of that stuff. And the best way to find all of that is on my website, which is just arthritis.yoga.
Yeah,
and
I'll
sure
put it
you'll
all
have
in
that
the
available.
show notes.
Yeah, great.
Yeah, wonderful. Thank you, Steffany.
Absolutely. It's been a pleasure, Shira.
Yeah.
Good luck with your book. I can't wait to read it.
Bye.
Bye.